Hello everyone and welcome. Today we're diving into a specific and often distressing condition, facial nerve palsy caused by middle ear pathology, and its impact on the eyes. Facial nerve palsy from middle ear issues arises when the facial nerve, responsible for controlling facial muscles including those that close the eye, gets damaged or compressed in the middle ear. This can happen due to several factors. Infections like otitis media, especially chronic or severe cases, can inflame the tissues surrounding the nerve. Cholesteatoma, a skin growth in the middle ear, can erode bone and directly compress the nerve. Less commonly, tumors in the middle ear can also be responsible. The pathophysiology hinges on the vulnerability of the facial nerve as it passes through the narrow confines of the temporal bone, specifically the middle ear. When an infection, growth, or inflammation occurs, it can directly compress, inflame, or even erode the protective sheath around the nerve. This disrupts the nerve's ability to transmit signals effectively to the facial muscles. A compromised nerve means weakened or paralyzed muscles, particularly those controlling eyelid closure. Without proper eyelid function, the eye is exposed and vulnerable. Facial nerve palsy secondary to middle ear disease isn't extremely common, but it also isn't rare. Its prevalence varies based on factors like the overall incidence of chronic otitis media, access to healthcare, and awareness of early symptoms. Populations with limited access to prompt medical treatment for ear infections might experience a higher incidence of this complication. It's important to note that while anyone can be affected, certain groups, like children with recurrent ear infections, may be at a slightly increased risk. The signs and symptoms can vary in severity, but some are highly characteristic. The most prominent is facial weakness or paralysis on one side of the face. This can manifest as difficulty smiling, frowning, or raising an eyebrow. Crucially, it impacts the eye. Inability to fully close the affected eye is a key sign, leading to symptoms like excessive dryness, tearing, irritation, and blurred vision. Patients may also experience drooping of the eyelid, ptosis, difficulty blinking, and increased sensitivity to light, photophobia. Additionally, patients may complain of taste disturbances, pain in or behind the ear, and increased sensitivity to sound. Diagnosing facial nerve palsy due to middle ear pathology involves a thorough clinical examination and a careful review of the patient's medical history, including any history of ear infections or ear problems. A complete neuro-otologic exam is essential. Otoscopy, examining the ear canal and eardrum, can reveal signs of infection, cholesteatoma, or other abnormalities. Audiometry, a hearing test, assesses hearing function and can help pinpoint the location of the lesion. Imaging studies, such as CT scans or MRI, are often necessary to visualize the facial nerve, middle ear structures, and rule out other potential causes like tumors. Electroneurography, ENOGA, or electromyography, EMG, may be used to assess the extent of nerve damage. While facial nerve palsy itself isn't categorized into specific types, the underlying causes within the middle ear can be. For example, the palsy could be due to acute otitis media, chronic otitis media, cholesteatoma, or a middle ear tumor. Each of these underlying conditions will influence the specific approach to treatment. Treatment and management are multifaceted, focusing on both the underlying middle ear pathology and protecting the affected eye. If an infection is present, antibiotics are the first line of defense. Cholesteatoma or tumors typically require surgical removal to relieve pressure on the nerve and prevent further damage. As for the eye, artificial tears are crucial to keep the cornea moist and prevent dryness. Lubricating eye ointments can be used at night. Eyelid taping or patching can help keep the eye closed during sleep. In some cases, surgical procedures like tarsorrhaphy, which partially or completely sutures the eyelids together, may be necessary to provide long-term protection to the cornea. Physical therapy can help to rehabilitate the facial muscles. Oral steroids may be prescribed to reduce inflammation and swelling around the nerve. Prevention primarily revolves around prompt and effective treatment of middle ear infections. Encouraging good hygiene practices, such as frequent hand washing, can help prevent the spread of infections. Routine ear examinations, especially for children with a history of ear problems, can help detect and address issues early. Educating parents about the signs and symptoms of ear infections can lead to earlier intervention and potentially prevent complications. The prognosis for facial nerve palsy due to middle ear pathology varies depending on the severity and underlying cause. With prompt diagnosis and treatment, many patients experience significant recovery of facial nerve function. However, some may experience residual weakness or long-term complications. Recent advances in surgical techniques and nerve reconstruction procedures are improving outcomes for patients with severe nerve damage. Research continues to explore new therapeutic strategies, including the use of nerve growth factors and other regenerative medicine approaches, to enhance nerve regeneration and improve functional recovery.